The following segment is presented by Bremo Pharmacy.
They call it the silent killer. Often the first signs of untreated high blood pressure can be a stroke or a heart attack. It's why it's so very important that you know your numbers. Bremo Pharmacy is here. Ann Anderson, as always, it's great to see you.
Good to see you.
I'd like to talk a little bit about what high blood pressure is to begin with, in case we don't know what that entails medically.
What it boils down to, it results from when there's too much pressure exerted on the artery walls by the blood that's trying to go through those arteries. In other words, if you're trying to put too much air in a tire, there's going to be damage to that tire.
Sure.
Likewise, water through a hose. If there's too much, the hose is going to be damaged. If the pressure's too high on the artery walls get damaged, which in turn leads to heart damage.
All right, that sounds very bad, and I can see why this is such an important topic this month. Who is high blood pressure more likely to affect? Is there a particular group of folks?
Well, there are. African Americans, those who are over 55, and people who've got a family history of heart disease or hypertension or diabetes. Those are all family risk factors that put you at risk for hypertension. Then there are the things in your lifestyle that you can control, and people who are overweight, people who don't exercise, smokers, people who drink too much, those are all people who are at risk for hypertension as well.
So if you've got a genetic component and poor lifestyle choices, then you could have a real problem. I actually read a statistic that said 1 in every 5 Americans has high blood pressure and doesn't even know it.
And doesn't know it. As you referred to, it's a silent killer. There are not symptoms. So like you said, heart attack, stroke, that could be your first sign. Kidney damage, that could be the first sign.
All right, well, we've said several times it's important to know your numbers. What numbers are we finding out, and how do we find them out?
And in answer to your question, it varies who you're talking to. Because for a normal, healthy adult, it's 120/80. But if you've got diabetes or kidney disease, or if you're over 60, those numbers might look a little bit different for you. So you and your doctor can determine the numbers that are appropriate for you.
Okay, so my normal could be very different than it's not just one size fits all,
Right.
as usual. That's what's great about the services that Bremo Pharmacy actually offers, is that when you come in for a cardiovascular check with a pharmacist, you kind of discuss all that.
You do. And sitting down with your pharmacist, I mentioned the doctor earlier, but sitting down with your pharmacist, you can also determine what the appropriate numbers are. And when you come in for a cardiovascular risk assessment and in Bremo, they'll look not only at what your blood pressure numbers are when they measure it, but also what's your family history, what are your lifestyle choices, what medications are you on. They'll combine all those things, set the appropriate goals and action steps to get you to that goal.
That really gives you great conversations to have with your physician. Knowledge is power, so going in and finding out what those numbers are, I think that's great. It's important that we know our numbers, and I'm excited through the end of March, Bremo Pharmacy conducting these blood pressure screenings.
And it's more than just going to the grocery store and sticking your arm in a cuff.
Sure.
It does involve more, and you leave with more information.
All right, that's good stuff. All right, call Bremo Pharmacy today, 288-8361.